Despite being often named one of the healthiest states in the nation, there are significant disparities in health outcomes between our state's majority white population and its populations of color. For example, African American mortality rates are nearly twice as high as those of white Minnesotans of the same age. Every health system talks about how they want to increase patient engagement and crack behavior change. For many people, it's social hurdles like discrimination, access to healthy food, housing, and lack of power that result in worse outcomes and higher healthcare costs. This presentation is about a new community-centered housing solution for some of our sickest patients and the process of co-design that got us here. It's about leaving you with inspiration and strategies for empowering those most impacted by the health problems we seek to solve to be involved as leaders and designers.
Homelessness destroys health. My story is that I lived on the street for 11 years. While living on the streets 11 years, it was a hard thing for me to manage my health, take my medicine, or even pay for my cold patty due to the weather. And a lot of my friends that I know have gotten frostbite.
Homelessness is also costly from a financial perspective. Somebody experiencing homelessness is 5 times as likely to end up in the hospital and to stay there for 4 days longer. An average cost of a night in the inpatient unit is between $2,000 and $4,000, can be as high as $20,000 in the emergency room. Working alongside community has taught us that housing alone is not the answer, and supportive programming is not enough. Accepting flexible community is essential for creating stability and belonging for people who become housed, and really without that, many people end up back on the street.
Envision is designed to meet the needs. It's a diversity community across the spectrum and intensify living and learning together with low barriers and screening affordable housing and micro living and tiny housing, the community that is designed to build relationships. 20% of people that experience homelessness have a serious health issue. 60% have minor issues wrong with them, but 20% have never been homeless, but they bring a rich role of social networks and connection.
Envision offers a truly affordable price point so that the healthcare system can invest in housing. And we do this by reducing the footprint of our homes, sharing facilities, and leveraging really innovative manufacturing techniques that have all kind of allowed us to drop traditional development costs by 60%. So at this point, we have built a full-scale prototype. We have many partners on board, and we've initiated the process of getting the zoning changes we need. Where we're headed is a 2-year live demonstration pilot to house between 15 and 30 people in Minneapolis. So we are on our way to accomplishing a big vision, and we really attribute the success to the fact that Envision is designed and led by potential residents. And this is because co-design enables us to create something that people really want and will advocate for, and because co-design also motivates stakeholders to take us seriously. But what do we mean when we say it's designed by residents? And how do you meaningfully include community members when people are bringing such diverse experiences and skill sets and perspectives? We've learned a number of things. We're going to share 3 of our most important insights with you. Number 1, simple rule. Invite everyone to participate fully in every meeting, even if it means you run out of chairs, even if it means that you go off topic. Because equally including and valuing every person on the team allows everybody to be able to speak confidently as experts on the project and stay on the same page.
We participate in meetings with important leaders like Jeremy Ellis and Mara Friars. We sit down and we represent our projects to them, and they seem interesting. We include them. They got to have an idea, but we bring the blueprint. You can tell by the interest and the smile on their face.
At Envision, the Deputy Chief Innovation Officer, who is also a trauma surgeon, is involved on the project, works on it each week, and really having a member with connections to institutional stakeholders inspires the whole team that we can accomplish a big difficult vision together.
Even though Bill's coming to work with us, he also brings the energy with him. He brings his whole family with us, and his wife brings food for the soul. And we sit down every Friday to have a meal. And we like to say thanks to our comrade Dwayne, because he does the dishes.
Keep going.
And here we are working on a decision whether or not to allow drugs in our community. It's a hard decision, but we don't want to turn anyone away. We want people to stay in recovery. We want people to stay sober. We decided that there's no barriers to living in Envision.
So engaging in big topics through simple and focused activities enables a diverse group to wrestle with complexity in productive ways. So we took the agreements made in those sessions and made an Envision operating handbook, which allows us to a visual artifact to communicate what life at Envision is really like and to show progress. So this is hard work and it takes time. Envision is innovation. Envision and innovation are essential, but almost always perceived as extra. So the only people that can really kick us out of our complacency and hold us to the task of justice and fairness are those with lived experience of the issues.
I want to close by a personal benefit of me being in housing. I'm able to manage my medicine. I'm able to make the doctor's appointment. I'm able to rest for the next day. I feel like it's in a safe place. And it really, right now, it feels real good to be able to be here with you guys today, and I appreciate it, and thank you for having us.
Good job, Freddie.
Thank you.
Yeah,
Very much.
thank you.
Thank you very much. I'm curious, what was the fact that you have incorporated the community into these conversations? How did that change the thing? Did it start as apartments or bigger houses and become tiny houses because of the community input? Like, what are the differences we now see because of that community input?
Well, one of the things is, tiny houses themselves are not that novel. We're hearing about them more and more, but when our Envision leaders, Freddie, Rome, Dwayne, Janelle, Sherry, many of whom are here, really took us on. Mm-hmm. They emphasize the importance of building community. So Envision is really about creating opportunities for relationships among a diverse group of people. So as Freddie was mentioning, 20% of people are kind of the highest healthcare utilizers. There's the most potential for cost savings there, but that doesn't allow for a really rich, diverse community. So these guys really infused the vision with this idea of building intentional community into the housing vision.
Would you add anything to that?
Yeah, well, it's designed by those who experience homelessness. Mm-hmm. They say, we have an idea that people want us to live, but it's the way we want to live.
Here's what I think you need, right, versus, no, I can tell you what I need.
Yeah, right. Well, I can tell you what I need, not you telling us what we need.
That's right.
Also the idea of self-governance. So that was something that was really important to our team, that it doesn't have a feel of being institutional, which is quite different than most supportive housing out there. So that's part of the reason for the operating handbook, is how do you manage self-governance, and that was something that was really important as well.
Thank you both for being here.
Thank you.
Appreciate it.